We'll get started in just a few minutes. If we're waiting for 11 o'clock. Good morning, everyone, and welcome to Webinar Wednesday with Palmetto Care Connections. We're so excited to have Lauren O'Brien from Little River Medical Center joining us today. In light of School-Based Health Awareness Month, our topic is school-based telehealth today. Before we begin our webinar, I'd like to just remind everyone that this webinar is being recorded for educational purposes. The webinar recording and the presentation will be available on our website after the webinar has ended. If you have any questions during the webinar, please use the chat box or the Q&A box. If you see it, it should be located on your menu bar. All questions will be answered at the end of the webinar. I'd also like to just introduce Lauren. She's the Community Programs Manager at Little River Medical Center. She has over 10 years of medical experience, including 7 years of specializing in pediatrics and 5 years focusing on the telehealth integration and implementation. She oversees the Parents as Teachers program, early childhood development, and school-based and organization-wide telehealth across 6 medical offices and 2 schools. She holds a Bachelor of Science in Nursing from the Western Governors University, and she is also dedicated to ensuring equitable access to quality healthcare. We're so glad to have you with us today, Lauren. Feel free to go forward with your presentation.
Good morning. As Davia said, my name is Lauren, and I'm excited to have the opportunity to talk about the impact that Little River Medical Center's school-based telehealth program has had on the students within the community of Laura, South Carolina. If you were present at the Telehealth Summit back in October, this presentation is going to look very familiar. So I will be providing you with statistical and qualitative evidence of the effectiveness of the school-based telehealth program. I will also cover the program's background, service model, challenges, solutions, and future plans. Let me start by giving you a little bit of a background about our company. So Little River Medical Center is a federally qualified health center in Horry County, South Carolina. It currently consists of 6 medical offices, which provide a variety of services, including adult, pediatric, and senior medical care, women's health, dental care, behavioral health services, a pharmacy, family support services, and mobile medical care. The center accepts all insurances and has a sliding fee option available to assist those who do not have insurance. The center's mission is to change lives and serve communities, and according to the American Hospital Association, the primary focus of an FQHC is to enhance the provision of primary care services in medically underserved urban and rural communities. Our services go beyond primary care and include assistance for our community's most vulnerable individuals and families and overcoming barriers which can affect their well-being and quality of life. One resource we have fully embraced to enhance patient care, convenience, and safety at Little River Medical Center is telehealth. Each of our 6 medical offices is equipped with at least one telehealth cart dedicated to doctor appointments and another for behavioral health appointments. To ensure seamless integration, each hallway is equipped with a tele-ready room, which consists of a computer, camera, microphones, speakers, and a set of peripherals. We also provide iPads for flexible telehealth consultations. Our providers, including behavioral health specialists and telepsychiatrists from MUSC, connect with patients via reliable, HIPAA-compliant platforms like Doxy, Polycom, and Helo. This robust telehealth infrastructure allows us to extend our reach and provide high-quality care to our patients, regardless of the provider's or patient's location. So the provider can connect with the patient from a different LRMC location, at home, or even from MUSC. With the combination of our mission and our abundant telehealth resources, we decided to initiate a school-based telehealth program into schools within Horry County to address healthcare inequities and assist medically vulnerable communities. According to the National Institutes of Health, communities at risk of medical vulnerability are underprivileged socioeconomically, rural, and contain minority groups who struggle with disparities. Rural communities face disparities, including lower median incomes, higher poverty rates, and limited access to vital resources such as healthcare and transportation. As you can see within this data collected by the United States Census Bureau and the U.S. News, Florida, South Carolina falls within the definition of a medically vulnerable population. In collaboration with the Horry County School District, we introduced our program to the community of Loris, not only to effectively contribute to our school-based telehealth mission, not only to actively pursue our goal as an FQHC, but also to effectively contribute to our school-based telehealth mission to empower health, enable learning, and foster convenience. School-based telehealth services were initiated at Daisy Elementary School in October 2019 and at Loris Elementary School in February 2020. Unfortunately, the coronavirus pandemic resulted in school closures globally in March of 2020. During the 2020-2021 school year, our telehealth focus shifted to program improvements and organization-wide needs within our medical offices. LRMC established a mobile medical team with a family nurse practitioner in June of 2021. This created more opportunities for our school-based patients to be seen. We entered back into the schools in August of 2021, and the 2 following school years were very successful for us. So the 23-24 school year began with the internet policy change, resulting in a requirement for LRMC to install our own internet within the schools. This delayed our services for months while different teams collaborated to install the necessary infrastructure. We are currently offering our services to Loris and Daisy in the 24-25 school year, and we will be honored to expand to other schools in the upcoming school years. The integration of telehealth into the school settings aims to enhance healthcare accessibility for students, minimizing disruptions to their education while alleviating the burden on families. While offering accessible and timely consultations, diagnoses, treatment plans, and prescription services, we ensure students remain healthy and engaged in their education. As you can see in this time study comparison, this program saves parents valuable time and reduces stress typically associated with traditional healthcare visits. It also supports school staff in maintaining continuity in classroom learning by reducing absences and by taking necessary precautions against contagious illnesses to maintain classroom safety. Therefore, the program fosters a community where students, families, and schools thrive. So this right here is a visual representation of the extensive time and effort that it takes for a sick student to receive care after presenting to the school nurse without school-based telehealth. As you can see, it could take anywhere between 5 hours to 2 days to receive medical care outside of the school versus the 30 minutes that it would take to receive care at the school. LRMC has employed registered nurses and licensed practical nurses that are assigned on-site at each school to provide a fully comprehensive exam. The presence of the LRMC nurse ensures that each assessment is the same quality as one performed during an in-office visit. The nurses incorporate external devices in addition to the visual and auditory components of the telehealth machine, which allows LRMC providers to complete a full physical assessment remotely. School-based medical encounters are completed using telehealth equipment that include iPads, telecarts, electronic stethoscopes, high-definition cameras, and scopes that allow the provider to complete an in-depth, high-quality clinical assessment. With this equipment, the LRMC provider and the nurse team are able to provide audio of the student's heart and their lung sounds, in addition to sharing real-time images of the eyes, the nose, the throat, the ear canals, and the tympanic membranes. A quick disclaimer here, The equipment shown in this presentation are displayed for educational purposes only, so we have no financial obligation to the companies associated with the equipment here. Different conditions that are eligible for telehealth in the school include minor injuries, allergies, flu or COVID symptoms, sore throat, lice, conjunctivitis, earaches, headaches, bug bites, essentially anything that can be seen by a doctor without the use of a diagnostic imaging equipment or extensive physical assessment. The tests that we have available within the schools include COVID, flu, and strep tests, urinalysis, hemoglobin and glucose checks. And we can also send an upper respiratory culture or a urine sample to LabCorp if further investigation is necessary. We can complete a nebulizer treatment within the school, as well as an ear lavage, and we also have a couple of medications available for administration as requested by the provider during the encounter. So now let's walk through a school-based telehealth appointment together. A student complained of ear pain while in class. Her teacher sent her to the school nurse for an assessment. The school nurse's assessment led to concerns of a possible ear infection due to her visualization of a red and bulging tympanic membrane. She called the student's parent regarding her concerns, and the parent stated that she did not have a reliable transportation at the moment, and she expressed frustration that her daughter's pediatrician never has appointments available. The school nurse informed mom that her child could complete a medical appointment within the school through LRMC's telehealth program. Mom agreed to these services and was transferred to my phone. I did not already have written consent on file for this patient, so I provided mom with a link to our virtual consent form. After receiving the consent back, I collected the patient's vitals and notified an available LRMC provider that we were ready for her to call our telehealth cart at the school. Hi, Dr. Todd. My name's Lauren, and I'm your telepresenter and your registered nurse today. This right here is we're at Forest Elementary School. She's been complaining of right ear pain at the end of the morning. She does not have a fever, and mom says that she's not complaining any at all. And really had any call, fever, that's cold protocol. No, ma'am. That is that long to take a look. Yeah, that's an ear infection. Right? So now I know where it's her right eye, her left eye, left nostril, her right nostril. You can open the nostril, so it doesn't. Right. Okay. Good job. Okay. Good. Mark, we listen to a hormone. And for all the medical people watching, I have gloves on, my hair is up, and I auscultate effectively during my actual encounters. What I'm going to do is put some antibiotics to the pharmacy and have your mom pick it up. So we'll ask Lauren to use Tylenol today and go back to class. Start building on those things. After concluding the visit, I gave the child Tylenol and had her head back to class. Medications prescribed by the provider were ordered to mom's preferred pharmacy. I then called mom back and provided a summary of the visit's evaluation, diagnosis, treatment plan, and follow-up recommendations. I instructed her to pick up her daughter's prescription from the pharmacy, and I answered any questions that she had. Lastly, I faxed the patient's chart summary to her primary care provider to encourage continuity of care. For evaluation, continuous improvement efforts, and a representation of the success of our program, our nurses collect data throughout the school year that includes the number of enrollments based on the amount of consents we receive, the number of completed telehealth visits, local urgent care and emergency department cost avoidance by participants based off of average costs in South Carolina per year, total amount of clinical tests performed, as well as details including which tests and their results, number of students able to return to class, and amount of instructional time saved as a result of utilizing our services, and the average amount of time that the telehealth visit took to complete. This data is demonstrated in our telehealth cumulative report at the end of each school year. We also have our nurses keep a record of students who presented to the nurse's office but were not seen by telehealth and the reason that they weren't seen. So after we implemented our program into DC Elementary in October of 2019, 52 parents consented to their child receiving telemedical care at school. This accounted for over 8% of DC's 600 students. A total of 7 encounters occurred during the school year, averaging around 23 minutes each. Of the 7 students, 6 clinical tests were collected and resulted, and 1 child was able to return to class. A minimum of 5 hours and 20 minutes of instructional time was saved due to our provided services. This time is calculated based on a single school day, which concludes at 2:30. However, there are multiple instances in which more time was saved. So had they not been seen by us, their medical office may not have had an appointment available for the next day or two, or their parents may not have been able to miss work. They may not have had reliable transportation, ultimately causing them to miss even more school. Our services potentially saved an estimate of over $1,000 in urgent care costs and over $12,000 in emergency room expenses. Our program entered Forest Elementary in February of 2020. Unfortunately, a month later, the coronavirus pandemic resulted in school closures, so no measurable statistics were collected for Loris Elementary this school year. Precautions related to the pandemic continued through the 2020-2021 school year. Therefore, our program did not resume during that period. Instead, we focused our attention on enhancing our registration packets, and we created a virtual registration link to allow parents to conveniently register online without having to come to the school first. To this day, well over 200 consents have been received using the registration link, and many parents have expressed their gratitude regarding the availability of this format. Our use of telehealth within the medical offices increased significantly during this time as well. Patients were able to receive quality care while adhering to the social distancing protocols, ensuring everyone's safety. We prioritize providing the same quality of care as an in-person appointment by offering extensive training on the peripherals and equipment available. It encouraged a large population of people patients, providers, and nurses to utilize telehealth when they might not have even considered it before. The pandemic familiarized families with the convenience, efficiency, and accessibility of telehealth, which I believe contributed to our great success when we entered back into the schools for the 21-22 school year. Between both schools, we received 215 new consents, bringing us to 229 active consents. Active consents are calculated by subtracting students who consented to be a part of our program previously, but have since moved or graduated to middle school from the total number of consents we have received from the initiation of the program. Our percentage of active consents increased from a little over 3% to over 17% between both schools. A total of 141 encounters occurred, averaging around 19 minutes each. Of these students, 179 clinical tests were collected and resulted, and 72 children were able to return to class. During this time, we were able to test patients for COVID and receive the results back within 15 minutes, while medical offices, urgent cares, and hospitals were overwhelmed. I don't know if you remember this, but it would take between 1 to 2 weeks to supply results to patients. With this in mind, a minimum of 256 hours and 32 minutes of instructional time was saved due to our services, and we potentially saved an estimate of over $25,000 in urgent care costs and over $247,000 in emergency room expenses. For the 22-23 school year, we received 163 new consents between both schools, bringing us to 327 active consents. Our percentage of active consents increased to almost 23% between both schools. A total of 180 encounters occurred, averaging around 17 minutes each. Of these students, 253 clinical tests were collected and resulted, and 70 children were able to return to class. A minimum of 217 hours and 33 minutes of instructional time was saved due to our services, and we potentially saved an estimate of $42,000 in urgent care costs and over $316,000 in ER expenses. During the last school year, our decreased time in the school due to network limitations caused a slight decrease in our statistics. Nevertheless, we still received a total of 109 new consents, bringing us to 344 active consents. Our percentage of active consents increased to over 24% between both schools. A total of 95 encounters occurred, averaging around 17 minutes each. Of these students, 167 clinical tests were collected and resulted, and 34 children were able to return to class. A minimum of 91 hours and 12 minutes of instructional time were saved due to our services, and we potentially saved an estimate of over $22,000 in urgent care costs and over $167,000 in ER expenses. Now let's go through an overview of the benefits of the program since its initiation in 2019. And now these statistics do not include this current school year. For the 2024-2025 school year, 548 students enrolled in our program. 423 medical telehealth encounters took place, with the average telehealth visit being 17 minutes. 605 clinical tests were completed, identifying 124 positives. We contributed to decreasing exposure to others within the school, reducing the spread of illnesses by way of quick diagnosis and treatment. Out of the 423 completed visits, 42% of students seen were able to return to class. This means that they did not test positive for a contagious illness in our office, they didn't have a fever, and they didn't have an immediate need for their prescribed medication or pain management cycle of care. A minimum of 570 hours and 37 minutes of instructional time was saved, which equals an average of 1.35 instructional hours saved per student. A total of $90,715 in local urgent care costs and $743,634 in local emergency department costs were avoided by participants by effectively diagnosing and treating eligible patients within the school. These amounts were calculated based off of the average annual and local costs according to United Healthcare and Talk to Mira, Inc. As the extensive quantitative data has shown, school-based telehealth has become valuable resource in the communities we serve. While the benefits of the program speak for themselves through the positive correlations within every single chart that I presented to you today, other benefits can be described through qualitative reviews. Let's hear what others have said over the past few years, starting with the registered nurse that I love very much at Doris Elementary School.
It has been very beneficial having telehealth here in the school. Pediatric offices are often full and overwhelmed and not able to see children in a reasonable time. Having telehealth in the schools was enable children to get care when otherwise they would not. I think I still don't take those having to wait for appointments. Many students were able to go right back to class after the telehealth provider determined that they were not contagious. Those students could have missed multiple days of school if it weren't for the telehealth services in the school. As a mom, telehealth in schools is such a huge asset. When you have a sick child, there can be a lot of running around and waiting. Telehealth completely takes that away and ensures your child is seen as soon as possible. This also means faster treatment for a sick child. In addition, it allows parents to stay at work longer while still ensuring that their child is receiving medical care. From what I've witnessed, telehealth has been very beneficial in keeping kids at school that can stay while ensuring that sick children who are going home will already have a treatment plan in place. I'd like to also add that many children fall through the cracks as they may go home and never be taken to a doctor. For these children, telehealth has been instrumental in getting them well. School-based telehealth is awesome thing to have at school. It benefited my daughter and I by not having to miss the day from work in school to go somewhere else to be seen. Miss Lauren and Wendy Moe are both very great with children and they made sure my daughter was 100% well. I was able to do the COVID test for my child right away, instead of waiting 5 or more days for the results to come back. Right after testing negative, he was able to finish his school day and I was able to stay at work.
I have had many parents express their gratitude regarding the ability to complete a medical appointment within the safety and familiarity of their child's school. Many parents admitted they did not have the resources to provide their child with a medical visit outside of the school due to not having reliable transportation or the ability to miss any more time off of work.
The program was with attendance due to getting excuses back quickly instead of having to wait days for providers to provide an excuse for absences.
As you can see, the overarching themes of our program revolve around convenience and comprehensive care. Bringing medical telehealth services directly to schools offers significant benefits, especially for vulnerable populations, including convenience. We minimize parental work disruptions and offer families convenient access to healthcare. Increased access to medical care. As illustrated earlier, these rurally located schools support families who often lack essential resources and families who may not be able to afford leaving work. Many are single parent homes, and adjusting childcare last minute to take a child to the doctor can be very difficult. All of these factors lead to decreased access to medical care for children. Oftentimes, the school nurse is the only medical professional that the student comes into contact with. The school nurse has limitations on what they can do to help students. So connecting students to our program is a way to increase the level of care that a child can receive to address both routine and urgent needs promptly. Our program is cost-effective, alleviates interruptions to parents' work schedules, and often eliminates transportation efforts. Decreased absences. Our program significantly reduces absenteeism in school classrooms. By providing medical care on site, we reduce the spread of illnesses, as students with contagious conditions can be quickly identified and sent home, enabling students to stay healthy and ready to learn. Faster diagnosis and treatment. With parental consent, every student has access to unlimited healthcare during the school day. As soon as a student feels unwell, they can receive prompt and effective medical care within the school, minimizing the spread of illnesses. Preventing delays in treatment, especially when local medical offices are overwhelmed and experiencing shortages in available appointments and long wait times, supports the overall health of students and the school community. One parent told me there is nothing worse than not being able to get to or comfort your child when they're sick or hurting. She said she feels helpless and overwhelmed when she knows that her child needs help, but she can't get to them for a couple of hours. She was grateful for the immediate care available at the school through telehealth. Collaborative care. Our program strengthens the school's support and capabilities. We contribute to a multidisciplinary team that includes medical professionals, parents, school staff, families, and patients. After a telehealth appointment at the school, the office note is forwarded to the student's primary care provider. This collaboration helps ensure follow-up and ongoing management of the student's health needs. Parents have control of their child's care from work. Parents can pick up their prescription if needed as soon as they pick up their child without any other stops. Parents can participate in telehealth visits either remotely or on-site at the school if they want to. Healthcare providers communicate with parents through their assigned medical nurse regarding service details, diagnoses, instructions, and electronic prescriptions as necessary. School staff contribute to the holistic wellness and illness prevention of their students by communicating with our program as soon as an illness is detected. Patients avoid exposure to more illnesses within urgent cares in the emergency rooms by receiving care in a clean, isolated room within the school. Continuity of care. We have the ability to identify gaps in children's medical care and ensure that they are following up with their primary care providers effectively. Health education and illness prevention. We provide literature as well as spoken education as a part of each of our visits to promote wellness and prevent future illnesses. So as far as next steps, we would like to begin offering more education to our students and families. I would like to hold an annual wellness class for students where we could teach them about the importance of things like exercise, nutrition, emotional health. I would also like to host a telehealth wellness night to familiarize families with the telehealth equipment and our pediatric providers by having a provider call into our telehealth cart at the school to answer some questions. We would be honored to bring the same quality healthcare to additional elementary schools within Horry County. I'm eager to expand to other communities within the county so that we can provide healthcare to a larger population of people. I would like to initiate a feedback system to allow parents to give an overview of their experience with the program to allow for improvements in the process. I would like to collaborate more closely with our wonderful mobile team to possibly schedule and complete routine well-child visits and vaccine administration for our school-based patients. We already have a dental bus that rotates through our schools, and I believe it would be beneficial to have our medical bus complete a similar type of rotation. My next slide will expand on my desire to continue and expand our outreach efforts. So using the images from previous outreach projects, I have created a vision board. If you don't already know, a vision board is an artistic creation intended to motivate the fulfillment of goals. In the past, we have been interviewed by local news stations. We've held art contests with over 400 participants per year. We give goodies and toys throughout the year to children and staff, including poppets, bookmarks, stickers, band-aids, chapstick, candy, crayons. We attend community events like the Loris Bog Off, back-to-school events, family nights, orientation, trunk or treat, and we love to participate in spirit weeks. My vision is to provide safe, convenient, and beneficial medical care to as many people as possible, and in order to increase our enrollments, I would like for us to continue showing up for our community with the continued support of our amazing Horry County school staff. As the data has shown, Little River Medical Center's school-based telehealth program has become a valuable resource in the communities we serve. Our program has significantly improved student health outcomes, reduced educational disruptions, and alleviated the burden on families. We are excited about the possibility of program expansion and continuing to positively impact communities. Does anybody have any questions for me? Or are there any questions in the chat for me?
I do not see any questions yet, so we'll give them a few minutes to ask their questions in the chat.
Okay.
I see Victoria has raised her hand. Victoria, are you able to enter your question into the chat? We do have a question, Lauren.
Okay.
Is someone present at the school 5 days a week?
Yes. So we have a nurse assigned to their school from 7 a.m. to 3:30, 5 days a week.
Here's another question. How do you handle school employee issues or illnesses? Is this a cash pay service if they are not a patient with your office?
Okay, two questions. So cash pay and employees. If there is an employee or a staff member at the school that's sick, we are not allowed to see them. We are only contracted to see the children. So I can give our school nurses at the school are extremely helpful. So staff will go to them to ask questions, and I can be back up if I need to be. But they're very capable of handling those kinds of questions for the staff, like where they need to go. They need to go to a doctor's office, to the hospital, that kind of thing. I wish we could see staff with our equipment and test them at the school. That would be great. But and then cash pay. We do not accept cash from our patients. We do accept all insurances, which most of our patients do have insurance. Most of the time, it is Medicaid, Medicare. Who knows? We have a few patients who have Blue Cross Blue Shield, but we haven't had a situation where we had a cash pay opportunity. We've just pushed the appointments through to their insurance.
One more question, Lauren, is this program only for rural communities?
It's not. We just happen to be in the Lourdes community at this point in time. But we have the ability to serve more of Horry County. If we were able to expand to other schools, that may not be as rural.
Questions are coming in. I love it. How do you handle students without insurance?
We actually have the sliding fee availability. So they can do the sliding fee option. I send them, just like I send them that registration link through email, I can send it to them. I can text it to them, I can send it to their email, and they can go online and do it that way. I can send them a sliding fee form for them to fill out and be able to, based on their income, they can pay for the appointments. So they can work with Little River Medical Center to see how they can pay for their appointments. So we work with patients who don't have insurance. And also we have an awesome team. It's an outreach team. So whenever I have a patient who's not set up with insurance, I will give them their contact information, and they can contact outreach and get set up with insurance. So outreach will do every single step with them or for them. They're really helpful.
All right. Who collects the quantitative data regarding consents, the telehealth team or the school?
The telehealth team does. We actually we have an Excel sheet that was created, and anytime we have an appointment, it just has like the top of it tells us what we need to put in there. So what time did the patient come into our room for the appointment? And then what time were they seen by the provider? When did the appointment end? When were they able to go home? How long did it take their parents to come pick them up? How many tests did they have? Which tests were positive? We keep all of that data inside of our Excel sheet.
So, how many people are on the telehealth team thinking about that? Because I guess the size of the telehealth team or the school nurse staff, or uh, it could vary throughout different communities. So could you tell us a little bit more about what the size of your outreach team looks like, or your telehealth team and the school nurses at each school?
Yeah, so we have two telepresenters. We have a registered nurse at Loris Elementary School, which is me, hey. And we have a licensed practical nurse, Deborah, at Daisy, and she's awesome. She's wonderful. We both work with a registered nurse that works at the school. They are the school nurse, so they see all of the patients that come into the nurse's office throughout the day. And so there's one at my school. Sometimes there's a float nurse that comes through and helps her because the Loris Elementary School has a lot of patients that come in every day. And then Daisy also has a float nurse that comes in sometimes and helps out. And then we have a system of providers, pediatric providers. I think we have about, I don't know off the top of my head, maybe around 8 or 9 that are available throughout the day for patient appointments that we can connect to. So they are highly trained in telehealth. They're very comfortable with pediatrics and using technology. Thank goodness, they're amazing. So we look at their schedule, see where they have openings, and then write them and say, hey, can you see our kid? This is what's going on. And they always say yes and pushes in. And outreach is a part of Little River Medical Center. We have so many resources in Little River Medical Center, and we could talk on that all day long. But outreach, I'd say there's probably 1 or 2 outreach employees at each of our 6 sites, and they'll do anything. I mean, they're amazing. If you need help with setting up somebody with insurance, sometimes if I have a patient who's Spanish speaking, who's a little uncomfortable with the translation service, they want to hear from somebody at Little River Medical Center that they're more comfortable with, that we can contact outreach to have them talk a little bit more about what we offer in our programs and stuff like that. And then the school's a part of our team too. I mean, the principals, they're really, really helpful. They keep us in there, keep us going. We've got people there that will post on Facebook for us to help us out, kind of do like PR into the community. I'm forgetting so many people because this program requires a lot of help from a lot of different people. We're just a big team working together.
Yes, that's it. Thank you for providing that insight. I have some more questions. How are you funded? Is this within your hospital budget or grant? And they're asking because hiring a telepresenter and an NP has been a challenge for us. And do you work with your children's hospital or a pediatric team for this?
We initially were grant funded for the program, and now we have been absorbed by Little River Medical Center, and we are now funded by Little River Medical Center. Did that answer all of that? I think I did.
Yes. Do you work with your children's hospital or a pediatric team any?
Children's Hospital. So the only way that we work with other medical teams is we send out the information from the appointments to their primary care provider. That's the only way that we really connect with other medical teams besides our own.
Gotcha. So
Yeah.
everything is through. It started out as a grant, but at this time, it is now everything's handled within Little River.
Yeah, so we also, to help kind of, I know that you said that someone was having an issue hiring an NP or a school-based telehealth nurse through their system. We do other things too during the day to help the company out. So, like for instance, one of our NPs, she helps out with a lot. She does a lot of our visits because she'll double book. She'll see us during her lunch period. She's amazing. She does the mobile unit. So she also sees patients out in the community. So not only is she helping us in school, but she's also helping other people in the community, other patients. So her schedule remains pretty full.
What is your typical number of students seen a day?
We can see no students a day up to 5 students a day at one school at a time.
Not that. And the question about the funding a second ago, one of the attendees said she would love to get some information from your metrics and measurement and how you help persuade management to justify the FTE support.
Okay. How can I connect with?
I will get y'all's contact information to each other.
Thank you.
And we'll go that way. And also, I would love to, as I mentioned at the beginning of the webinar, post the presentation on PCC's website. This recording will be available after the webinar has ended, in case anyone would like to share the webinar or review it if you joined late. Are there any other questions or comments? We thank you so much for joining. Lauren, thank you for providing this information. Again, it is School-Based Health Awareness Month. So thank you to all those who are involved with school-based health and school-based telehealth. Just keeping our children and our community healthy and happy, finding ways to increase access to care. You all are doing a wonderful job and you're appreciated. Thank y'all so much for joining. Hope you have a great afternoon.